This is John Voquette with the Newtown Bee. We are here at the Newtown Municipal Center, and this is the 16th of our Newtown Bee COVID-19 clips, our outreach message in cooperation with First Selectman Dan Rosenthal, his office, and the Newtown Health District, and their director, Donna Culbert. Both of them are with me here today. We're going to kick things off with Dan talking just a little bit on a high level about continuing bad news in that the virus is here and there's new variants virtually a couple of towns away. But Dan, also some good news in terms of what you're seeing with the rollout of the vaccines.
There's always, thank you, John, and thank you to the Bee for hosting us today. There's always cause for concern. Certainly with the variant, we need to remain vigilant in terms of trying to avoid social gatherings and still sanitizing, washing our hands and keeping our distance, wearing masks. But I also think there are a lot of positives. Our children are back in school full time, which I think is critically important, and my hat's off to the superintendent and the staff and the schools for getting that done, and also, of course, our health department. And we're seeing the vaccine rollout. And I know that there's a lot of anxiety out there because, again, the state guideline is still 75 and older. I am hearing from a lot of our residents that are over 75 that they have been able to, again, they filled out the form on our website. They've been able to schedule through VAMs. Many have actually gotten their first vaccination that way. And now we're at a point where we are, ready to start having a local clinic. Again, we have very limited supply, and we're prioritizing that supply based on, oldest to youngest. But again, I think there's a lot of positivity out there. And there is, I think, a light at the end of the tunnel. The governor's talking about trying to procure more vaccine. I'd like it to flow a lot faster. But again, I think that let's focus on the fact that things are moving. And I am hopeful that, as we go through the next few months, that we will have inoculated a very large percentage of our residents, and we'll be on our way.
Great. Donna, a couple of clinics scheduled for this week, but all booked in advance, right?
Absolutely. Our clinics are by appointment only. We've been working with our pre-registration list for our residents, working from the oldest down, because we have lots of wonderful seniors in our community. So it is by appointment only, and if people don't have email, we've been talking to them on the telephone. So we have that local pre-registration list, but we've also tried to encourage folks who are able and willing to avail themselves to VAMs to see if they can get a vaccine also in kind of our larger area. We know that we're not going to get a lot of vaccine all at once, and so if people have an opportunity, they should take advantage of that. But we're just trying to systematically work through the system, help everybody, get information out to them, ask people to be patient, and also ask people to be really careful in the meantime, because it's going to take a while to vaccinate everybody. Build up that herd immunity, and we want people to remain healthy all the time. It's keeping your distance, washing your hands, this cleaning and sanitizing, trying to discourage people from making larger social circles than the folks in their home. I can't tell you how important that is.
And the demand is only restricted by the supply in terms of the vaccine at this point, right?
That's correct. I mean, and I will say I think the state has been working very hard to provide a lot of different access points throughout the state. So what's happening is, at least at the moment, we kind of have a fixed line of what's coming in for vaccine into the state, and we're trying to spread it out over a large area. So, that's why I think there's some frustration, but there's also other opportunities. So, we're looking forward to more vaccine coming into the state as the weeks go on, and, we'll ramp up accordingly, but we're just trying to, prioritize with what we have.
So you talked about the sort of holy trinity of behavior, the disinfecting, mask wearing, and distancing. And I don't want to spend a lot of time, but we did see the B117 variant, the UK variant, now developed in 3 individuals from the town of Oxford, as we corresponded earlier. A little too close for comfort, but as far as you're concerned, your advice to people is just to keep on, if not heighten, those 3 tried and true practices.
Absolutely. I mean, I think if people could walk around and either assume that they have it or assume that the person they're interacting with has it and use all of those precautions, we could, at least limit, if not eliminate, transmission. And knowing that there's the variant in neighboring towns, it won't be too surprising when that, that makes its way in a lot of other areas, and probably including ours, and that's why we want people to keep up those precautions.
And, as we have been talking about quite regularly, your staff has seen more than double the number of positive cases develop in just a little over the past couple of months after kind of, cruising along at a fairly steady upswing. It just kind of jacked through the roof back beginning in mid-November. But I guess in closing, what I'd like you to talk about is reassuring folks who are out there who may not even know that they've been in proximity to somebody that has tested positive, and reinforcing the need to be open and cooperative with contact tracers, of which some work right out of your office.
That's correct. I mean, it's really important. I think people can answer the call. What we're really trying to do is find ways to support those individuals in their homes so that they can isolate or quarantine, depending on whether they're diagnosed or exposed, and be able to reach out to the other folks that have been exposed. The whole idea is just limiting the spread. So whether it's folks from our office, me, and other support in our office, or there's also regional and state contact tracers. We're just really interested in supporting people at home and making sure that we find contacts and limit their activity as well.
Right. So Dan, sounds like the community's in as good a place as it can be, and all the necessary auxiliary services are doing what they need to do to keep things as safe and healthy as possible.
Absolutely, John. And, again, my thanks to our health district, Donna. They've been working around the clock to make all this happen. First it was obviously all the contact tracing and trying to limit the spread as best they could, and now we're in the vaccine phase, so they're also managing that and I think doing a very good job. I would stress in closing, and Donna touched on it, if you have an appointment in VAMS, keep it. While we're getting some supply, it's very limited, so I really can't stress enough that residents that have been able to make appointments through VAMS, that they keep that, because based on the amount of supply we have, they may wait a very long time before we're able to vaccinate them in any local clinic. And I also want to stress the supply that we have, we are limiting only to our residents. So while they may be seeing in other areas, people are able to go to other towns and get a shot, we are limiting whatever limited supply we get to only our residents. And we will do that until we're satisfied that we've been able to vaccinate a large population.
Very good. John Voquette with the Newtown Bee here with our 16th installment of our COVID-19 clips, our ongoing public outreach messages done in cooperation with First Selectman Dan Rosenthal, his office in the Newtown Health District, and their director, Donna Culbert. Both joined me here today. Thank you both for your time, your great work, and for helping keep the community safe.
Thank you, John.
Thank you, John.